To give you some perspective on how devastating the coronavirus has been, consider this. There have now been more than 900,000 confirmed cases of COVID-19 in the United States, with over 53,000 deaths. Look at that number of deaths for a moment. Sometime this week, we're likely to pass the 58,000 lives we lost in Vietnam. That death toll took us more than a decade to hit. This has taken us about 12 weeks. In the past 7 days, at least 17 states and Washington, D.C. have registered their highest ever one-day total of coronavirus cases. The national curve may be flattening, but it's flattening at a very high level. What's now clear is that we as a country, particularly on the government level, have failed to meet the moment. There's not enough testing to understand the challenge we're confronting. 26 million people so far filed for unemployment, wiping out the gains made since the 2008 financial crisis. Money is not getting to the small businesses that need it to survive. And the President of the United States is floating ideas like injecting disinfectants into sick patients. It's against this backdrop that some of the nation's governors are taking the risky step of opening their states for business. Behind that decision, a brutal calculation that the unemployment, the hunger, the depression, and the social dislocations of a stalled economy are worse than the certainty of an even more larger death toll from COVID-19 as businesses reopen. Healthcare experts acknowledge the necessity of getting people back to work, but warn that moving too early could invite a second wave with disastrous consequences. Meanwhile, President Trump, eyeing the election in November, is grasping at any idea to stop the virus and get the economy back on track quickly.
Do you take any responsibility for these 50,000 deaths that have happened in this country?
I think we've done a great job.
As the U.S. death toll continues to climb, on Friday, the administration scrambled to contain the fallout from the president's suggestion that injecting household disinfectants might cure the coronavirus.
And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
Top administration officials tell NBC News that members of the coronavirus task force were shocked by those comments.
No, I certainly wouldn't recommend the internal ingestion of a disinfectant.
Surgeon General Jerome Adams warned, please always talk to your health provider first before administering any treatment, medication to yourself or a loved one. The EPA implored, never apply the product to yourself or others. The CDC tweeted, household cleaners and disinfectants can cause health problems when not used properly. And Mr. Trump's former FDA commissioner, who advises the task force,
there's no circumstance under which you should take a disinfectant or inject a disinfectant for the treatment of anything.
It's just the latest example of the president's desperate attempts to peddle treatments for a pandemic that is killing thousands each day. For weeks, the president touted the use of a malaria drug to treat the virus.
Hydroxychloroquine. It's worked unbelievably.
On Friday, the FDA issued a formal warning against use of the drug, citing heart rhythm problems. And the president has broken with the scientists who advise him on the most fundamental questions of the federal response. On testing,
we absolutely need to significantly ramp up not only the number of tests, but the capacity to actually perform them.
And on the virus's timeline.
We will have coronavirus in the fall.